guys, Kate85 here, and I am back with another video, which is a continuation of the heart procedure series. We already started part 1 a few days back, and now we're doing part 2. Again, we're doing a grand total of 4 diseases. The list is coronary artery bypass grafting, the coronary stent, the replacement of the ascending aorta, and the defibrillator. All are exciting diseases. So let's get into the first part of the video, and I'll see you then. We have the coronary artery bypass grafting. So basically what happens is that it treats atherosclerosis, sometimes heart attacks, in the coronary artery. It uses a strip of vein or artery from another part of the body, preferably the leg. They cut it off and then they take it to the heart. And then what they do is, say if this is the area of my blood clot where it is clogged off, like you can't use it anymore. Blood won't flow through it because of the plaque if there's a heart attack, or blood flow is restricted a lot because there is atherosclerosis affecting the region. They'll take that piece of vein or artery, they'll cut out the existing affected portion. Say this piece of artery is affected, they'll cut it out and then they'll use that piece of vein or artery from the other part of the body, the leg preferably, and they will just use it to bypass the blocked area. So sometimes they'll do it like that. And this restores blood flow to the heart. And it is one way to, as I said earlier, it is one way to treat atherosclerosis and sometimes heart attacks. So our next procedure, as to say, that we are going over is the coronary stent. So this procedure is used to treat atherosclerosis and heart attacks like the last one. But it's a different part. It does not involve in getting another piece of artery or vein from another piece of body. So like the last example, let's say that this area is clogged up, like there is plaque that restricts blood flow, or there's a clot there. Usually a clot, because that's where stents are usually used for heart attacks. So what they first do is they insert a catheter through a vein or through a blood vessel in your leg, and then what they do is that they wire it up, and then they insert it through, and then they wire it up through and get to that coronary artery, which is affected. And then they use a catheter, which they wired up, and then they aspirate the clot out, and then it clears the clot out of the artery, restoring blood flow, or with atherosclerosis, like opening it up. And then what they do is that they wire in a balloon stent. They wire it in from a leg, also preferably. They wire it in from a leg, and then they use a catheter, not a catheter, they use a balloon stent, and then it gets inserted, and then they wind it up to the coronary artery again, and then they inflate it, and then the stent expands, and that expands the blood artery, and that restores blood flow to the affected region, because earlier there would have been no or restricted blood flow due to the atherosclerosis in that region. So yes, and I know about the earlier two diseases, the coronary artery bypass grafting and the coronary stent. These two are used to treat atherosclerosis and heart attacks, and they primarily fix problems like they clear up blood flow or they bypass blood flow. It's just to resume blood flow. That's the main point of these two procedures. That's why doctors do it, and it saves the patient's lives from risk of a heart attack or a heart attack. So the next procedure that we are doing is the replacement of the ascending aorta. The reason why doctors would need to replace the ascending aorta of a heart, which by the way is this area over here, is because there might be an aortic aneurysm. So an aneurysm is like the ballooning or the bloating of an artery. So when there's an aortic aneurysm, you can imagine this area being like filled up like a balloon. So, and then sometimes that if the artery bursts, it can cause internal bleeding, and it can it can be fatal if it bursts. So what doctors choose to do is that they use a synthetic graft. So they have a plastic version or animal tissue version of a replacement aortic ascending aorta, and they just take out the existing piece, take it out, and then they install a new plastic piece or other synthetic piece, and they add it back in, and that restores blood flow, and it decreases the risk of of a person getting killed by an aortic aneurysm. So for this surgery, obviously there needs to be open heart surgery because you can't remove it without it can't be removed without an open heart surgery. So yeah. So the final of the 4 procedures that we are doing is a defibrillator. Sorry. Yeah. So a defibrillator is used for a patient for a patient with ventricular fibrillation, and then it delivers it's an external defibrillator, by the way. I wanted to point that out. It delivers a powerful current, and it shocks the heart back into a normal rhythm, and it saves that person's life. So I have a picture of a defibrillator right here, and it's an external defibrillator, and this is how they do it. And that shock, it puts the heart back in order. I want to emphasize on that. It puts the heart back in order, and the heart can go back to working. The heart gets shocked, and hopefully the pumping rhythm is normal for that patient. They use this for the ventricular fibrillation. At the end of this video, we have covered 4 procedures in total. So we are doing defibrillators. 4 procedures. Sorry. Let me start from the start. The coronary artery bypass grafting procedure, the coronary stent procedure, the replacement of the ascending aorta procedure, and the defibrillator procedure. So the coronary artery bypass grafting procedure is when they use a piece of artery or vein from another part of the body, and then they bypass a clogged artery in the heart. A coronary stent is where they use a stent, and then they expand the artery and keep it expand so blood flow returns to normal. The replacement of the ascending aorta is when there's an aortic aneurysm, and then they replace the aorta so it doesn't cause any damage. And the defibrillator is used when an external defibrillator is used to deliver a powerful shock for a patient with ventricular fibrillation to shock their heart back into a normal rhythm and save their lives. So this is the end of the video. I've been experimenting, and you might have noticed that this is a much longer video, about 10 minutes long. And I'm experimenting with a new style of making videos, and that's why it's pretty long. I hope you learned a lot from this video. More videos will come, and I am a bit busy with work, so that's why I'm not uploading that quickly. I'll hope to see you in a future video. Thanks for watching. KDude85 is out. Bye-bye.